The wish of a healthy child is what most parents ask for when expecting. But for more than 50 million families in the United States, that wish doesn't come true. These parents struggle with the realities of having a child or children with developmental disabilities, such as Down syndrome, autism, ADHD, sensory motor disorders, or many other diagnoses that affect the development of children. They look for ways to cope with therapies and finances, all while trying to strike the delicate balance between happiness and home. The Innovative Health Foundation understands these stresses on these families and was created to help provide funding for these children's and families' needs all across the globe.
The goal here in organizing the Innovative Health Foundation is really to recognize that the issues of the needs for children with developmental disabilities and their families is really a global issue. It's not any small town or any small town in the United States, but frankly children all over the world. In most countries these days there's a growing population of children with autism and attention deficits and a variety of other kinds of problems that are complicating not only the growth and development for a successful outcome for these children, but creating major difficulties and obstacles for the families as well. So ultimately we want to be able to have an organization that can reach out to all families of all cultures, all races, all countries.
Families such as the Lugers understand the complexities of dealing with children with developmental disabilities. Their son and daughter, Perry and Margot, both are on the autism spectrum.
It's a very lonely life because the people who understand live it. They have kids on the spectrum. The thing about autism is it's so varied, and Perry and Margot in themselves are so different, so that every child is different. Every person with autism is so different, and you have to find out what works for you, what your child or that person's individual needs and struggles are. So that's a lot of the battle, is figuring out what it is that we need to work on, and then you have to figure out how you need to tackle it.
Others, such as the Woods family, determined that their daughter Mary with Down syndrome would require a streamlined therapy that is intense and expensive. They already received some state funding through a waiver called Katie Beckett, but understand that they are one of the few.
If we didn't have the Medicaid waiver, we would not be receiving therapy for Mary Elizabeth. The cost would be too great for us. She may be able to come once a month, and that really wouldn't help her. So we'd probably have to just not. And there are a lot of families that do not pursue any kind of therapy because they can't afford it, or their insurance company doesn't cover it, or they don't want to embark on the Katie Beckett journey because it is arduous and very invasive, and they don't want to give out that much personal information about their life. So a lot of people do skip it.
In my almost 20 years of work with families and kids with special needs, I've seen so many issues come up where kids weren't getting the services they need. I've also seen situations where parents couldn't continue with the therapies that their kids needed because they couldn't afford it.
Dr. Eric Fisher, a child psychologist and board member of Innovative Health Foundation, has seen all too well the harsh realities of insurance and how they can potentially affect the health and development of a child.
Insurance can be very difficult because it's trying to basically weigh how do we get some people's needs met, why we might not be able to meet other people's needs, as well as how do we continue to make a profit. You know, it is a business that has to be run, and it's difficult because the emotional side of it is seeing the individual lives that not having the tools they need and the therapies they need and the help they need to see those people go through those emotional losses and the struggles that they have. That many times parents are stressed.
It is a struggle that Susan Mineo deals with daily. Her teenage son, Anthony, who has a severe autistic disorder, seizure disorder, and progressive behavior disorder, will require care for the rest of his life.
How people have to choose between if they can have therapy or not, or if their kids can have the medication or not, how to go about getting any of it. There's no book. You know, when your kid is diagnosed with any kind of disability, or even your adult, parents are, there's no real person to go to say, how do I go through this? What are my steps? What should I do first? If there is such a foundation that can help you, guide you through, all right, I don't have the funds, my son needs these or my daughter needs these things, how do I apply for that? What do I have to do?
The ability to have an organization like the Innovative Health Foundation bring all of these tools together for a family it's miraculous that we have this ability to do this now. Because for so many years and so many generations, you go to one therapist and get one thing done, you go to another therapist and get another thing done, and the vision of Dave Cantor to bring all this together, not just through Innovative Health Foundation, but it's something he really has tried to do throughout his career, took a lot of forethought. He saw the issues that families needed, he saw the issues that the individuals needed, and he's working to address those needs.
The Innovative Health Foundation is not only committed to providing access to today's therapies, but also wants to fund and pioneer cutting-edge techniques that could prove to be groundbreaking in developmental disabilities.
I'm seeing a lot of families who want to try some of the newer innovative therapies and don't have the funds for it. So I think that's someplace where the Innovative Health Foundation could be a huge benefit to parents who want to dive deeper into some of these therapies that are not covered by their other sources.
But it will take the efforts of the community to make the change that is so desperately needed.
While we're not a political organization, we want to get the ear of politicians. We want them to understand what's happening with their constituents and with the kids in those constituents. We have to help people understand the financial impact, the burden on the family, the community, on a society, as well as we have to look at the future.
If we have a growing population of adults who cannot contribute to society, it will be a burden on you one way or the other. And you have an opportunity to make a change here. You have an opportunity to intervene and make a better life, not only for these people, but for yourself and for your children in the future in helping to reduce the risk of these burdens as they're growing in our society.
That's the thing is, who's going to take care of them when we're gone, too.
The Innovative Health Foundation was formed to bring awareness to our communities of the needs of the children and the families with developmental disabilities. Thank you for your help and support of the Innovative Health Foundation.
Thank you,